Micro and endoscopic operating methods are nowadays state-of-the-art in medicine. With the development of balloon catheters for coronary artery dilation, new treatment methods have evolved that are now, for the first time, being used to treat eustachian tube dysfunctions. We are now, for the first time, initiating causal treatment for this chronic functional ear disorder, which means releasing blockages in the eustachian tube by means of an inflatable balloon. Professor Dr. Sudhoff developed this minimally invasive method at Klinikum Bielefeld Hospital. For the first time, it's now possible to treat adult patients with chronic ventilation disorders of the eustachian tube quickly and successfully. There's a whole series of patients with ventilation disorders. It's assumed that about 1 to 5% of the German population has difficulties in ventilating the ear properly. And you know that an impaired eustachian tube function can finally also lead to chronic bone suppuration and chronic middle ear infections. A pre-operative tubomanometry is performed on the patients. This examination method lasts only 5 to 10 minutes and allows a detailed and reliable diagnosis of functional eustachian tube disorders. It involves the measurement of the eustachian tube function, according to STEV, with which one can show whether the eustachian tube opens upon swallowing, which is physiological, and if subsequent pressure equalization takes place in the ear. This means that for the first time we have the possibility of performing an objective test for eustachian tube function. The therapeutic equipment comprises 4 components. The microendoscope, specially developed by Spiegler and Theis, is designed in such a way that it allows very controlled, minimally invasive advancement of the catheter into the eustachian tube. The insertion instrument has an integrated advance indicator with a lock to prevent the catheter from entering the tympanum. The flexible distal part of the balloon catheter has a coaxial structure. The outer lumen is used for inflating the balloon. The proximal section of the catheter is a single stainless steel lumen. The insufflation syringe has a convenient, quick-acting closure for single-handed activation, as well as a rotating hand grip, pressure gauge, and high-pressure port with Luer-lock rotating adapter. The special feature of the new method is that it is minimally invasive, that it can be performed in a short period of time, and that essential physiological conditions can be restored with a minimum of effort. For the operation, I first perform a nasal endoscopy. This means going into the nose with a light rod, looking at the anatomical structures and checking for the presence of mechanical obstacles that may also be contributing to the functional disorder of the eustachian tube. Then a colleague who assists in this procedure inserts a catheter into the endoscope. Before inflating the catheter, we check endoscopically if it's correctly positioned. The balloon catheter has a pressure of 10 bar, which is maintained over 2 minutes. Finally, the fluid is aspired from the balloon and the catheter is carefully removed with the endoscope, upon which treatment is completed. The balloon dilation of the eustachian tube can be performed as an inpatient procedure under short general anesthesia. Complications have not occurred in previously performed treatments. First studies have shown a clear improvement of the eustachian tube function, even after a year. The special new aspect of this method is that up to now, there has been no possibility of treating this functional disorder successfully, and for the first time, we're able to rectify this functional disorder by means of a balloon catheter, using an approach modeled from the dilation of coronary arteries.